Welcome everyone. I'm Councillor Matthew Whittington, Cabinet Member for Community Wellbeing, Health and Care. Just some housekeeping. If the continuous fire alarm sounds, please evacuate the room and public gallery. There's no one in the public gallery. By the stairwells. Do not attempt to use the lifts. Please assemble by Queen Victoria's statue in Guildhall Square. In order to comply with the Guildhall Trust Fire Marshal regulations, anyone who signed in at the Guildhall reception desk should sign out when leaving the building at the end of today's meeting. There's no members of the press and public. Please can everyone use the microphones to remember to switch them off when they have finished. And just do some introductions. So start on my left.
Anna Martin, Democratic Services.
Andy Biddle, Director of Adult Social Care.
Richard Webb, Deputy Director of Finance.
Brian Medwick, Councillor for Portsgrove Ward, Opposition Spokesman.
Claire Curry, Assistant Director of Public Health.
Matt Gummerson, Assistant Director of Public Health.
Councillor Graham Heaney, Labour Group Spokesperson for Community Wellbeing, Health and Care.
And we also have Honorary Alderman Alan Burnett with us as well. Would you like to introduce yourself, Alan?
Well, I've only skimmed the report, but I'm here as an observer. Thank you very much. Yep.
You're very welcome, Alan. Apologies for absence. So we have Councillor Lewis Gosling and Helen Atkinson, Director of Public Health, for which Claire and Matt are substituting today. Members, any declarations of interest? No, thank you. So, without further ado, move on to item 3, Public Health Strategy 2023 to 2026. Over to you, Claire.
Thank you very much, Councillor Whittington. So I'm here, as you've said, on behalf of Helen Atkinson, Director of Public Health, to present to you the Public Health Strategy, which we hope is a useful document for partners. It's a 3-year strategy which aims to articulate our public health approach, as well as setting out our longer-term and shorter-term aims within our work. We framed our public health approach across 4 domains, which reflect both our statutory and professional responsibilities, setting out our thematic approach to understand the health and well-being of our local population, protect the health and well-being, prevent ill health, and improve health and well-being for all of our communities and those within them. Our longer-term aims are likely to be fairly consistent over the life course of the strategy, while we hope to update the shorter-term aims to ensure that the strategy remains current during the lifetime of the strategy and beyond. The strategy does spend some time describing our work that has gone on across a lot of time in these areas, and we're very proud of a lot of these achievements, and we do feel that they make a real difference to our local residents. But we also recognise a lot of what we do is in collaboration with partners, both across the council in a variety of directorates, as well as with the NHS and others, including the university, community voluntary sector, and lots more. We have sought to make these connections in the strategy in terms of the areas of work that we are focusing on, and indeed how we're linking with both the ICB and ICP priorities. So I would like to take this opportunity to thank all partners who we work with to positively work together in achieving the aims and ambitions as set out in our public health approach. I'm really happy to answer any questions or pick up comments that you'd like to.
Thank you very much, Claire. Just before we begin on comments, etc., in the pre-agenda for this item, we had a discussion and Councillor Heaney came up with the suggestion, which I thought was very appropriate, that we turn this into an action report as opposed to a noting report, and that we refer this on to Cabinet, as then this will then be able to be put on the agenda for full council as well, as though this is a report which is mainly used for internal and partner purposes. We thought that, especially in terms of the areas noted on page 8, which is about all the different strategies and plans that this fits into, including such things as the Children's Trust Plan, the local plan, and the air quality strategy and air quality action plan, that it would make a lot of sense for this to be at a come to a place which covers all of that, which of course would be both Cabinet and full Council. So I'm going to go over to, so I'm very happy for that, but I'd just like Graham, if you'd like to make the formal ask for that to happen, which I'm very happy to agree to.
Yes, thank you, Matt. Well, we did discuss that, and I think given the importance of the report and what it contains, I think it is useful for other members of the Council to be aware of it who are not involved in health and care, because I think it does provide us with a good overview of what's going on, so I think it would be worthwhile doing that. I suppose I do have one question in the sense of, we've now got the strategy, and what are we going to do about reporting back on the achievements of the strategy or progress on the strategy? How are we going to do that? I mean, obviously we'll need a bit of time for things to work, but have we got a sort of idea about whether we'll report back annually or shorter or longer term?
Thank you, Councillor Heaney. I suppose one point of view on that, there's various strands within the strategy, and lots of those have their own sort of, governance reporting, as you'll expect, and of course some of those are visible to the Council through the Health and Wellbeing Board or indeed through other routes. I think we'd be really happy to bring a regular update at some point on the progress that we've made through various bits, if that would help, and also in terms of might provide that background to how we perhaps update the shorter term aims in the strategy as we move forward.
Thanks, Claire. Brian, did you have any comments or questions?
No, I'm happy with all that, Matt. Thank you.
Okay, so Graham, was there anything else you wanted to say?
No, that's fine. Thank you.
Thank you. Just to put on record my thanks for this strategy. It is, as we've been discussing, very important for across the Council, very important for our partners locally, and it really does give us that opportunity to bring a lot of these things together that sometimes can seem quite disparate, but in the end all come under health and wellbeing and public health in general. So as per the discussion and Graham making that formal request, I'm very happy to them, as I say, make this report an action report that we will resolve, that I will resolve to refer this on to Cabinet for discussion, in which case that can then go out to all of the Council, and then at that point I will also ask that it is made sure that it's a report that then can be go on the agenda for full Council, which then at least gives everyone a proper opportunity to do that, and also anyone who's looking at the full Council report can see that that is part of it, as this is something that really does cover every part of the Council and well beyond. So that is what I have resolved to do. Okay, so we move on to item 4, the Public Health Annual Report. Matt, over to you.
Thank you, Chair. I'm here presenting the Director of Public Health's statutory annual report. So Helen has a requirement as DPH to produce a report every year. And this report this year focuses on poverty and the cost of living. So building on a lot of the work that's been done over the last year to understand the impact of the cost of living crisis in Portsmouth, and acting as a refreshed kind of needs assessment to inform the work of the Tackling Poverty Steering Group that leads on poverty as an issue, a priority within the Health and Wellbeing Strategy, reporting into the Health and Wellbeing Board. So trying to achieve multiple aims through this report. It's a piece of work that a number of people have contributed, too numerous to list here, so I'm very much presenting the work, but a lot of other people have contributed to it, so I want to record thanks to everyone that supported us in developing this report. It will be reproduced in a more accessible format, so we'll be doing some design work around it, producing an executive summary that provides kind of some more infographic representation of some of the key points as well, so it's useful for a range of audiences. And at that point, we'll make that available on the poverty and cost of living section of the Joint Strategic Needs Assessment page on the City Council website, where you can already find now a lot of the cost of living data that we've been working on. So that's also available to members of the public or anyone else that wants to access that. In terms of the report itself, it's quite a long report. I don't intend to go through it all now. I encourage you all to read it because I think there's some really key findings in there. Just to put out a few key things, if I may. Obviously, there are numerous different ways of defining poverty, and we've tried to consider a range of these so we get the fullest possible understanding of the issue and how it impacts on different communities in Portsmouth. But depending on how you measure it, there's some fairly stark statistics in there, with between a quarter and a third of children in Portsmouth growing up in households in poverty, really kind of highlighting the impact that these issues will have across a range of City Council and Health Wellbeing Board priorities. We know the impacts that poverty has on health, the impacts it has on life expectancy. We've also tried to highlight the interrelated issues around a number of other issues, for example, education attainment, where the gap between pupils in Portsmouth on free school meals and their non-free school meal peers is larger than the gap nationally. So again, it's all connected to other priorities. Obviously, we've then got data on the cost of living crisis, which has brought a whole new set of people into being impacted by these issues that were not previously within definitions of poverty necessarily, but does mean that there are people experiencing challenges that weren't before, but also reiterating the point that those who were already vulnerable to poverty are most likely to have been affected and most severely affected by those changes as well. And we tried to highlight that within the document. Also provide a summary of kind of local efforts to tackle poverty over numerous years and how this fits into that, and looking at some examples of good practice from elsewhere where we can learn some lessons from things that other people have been doing. And then section 4 just again highlights some of the efforts around cost of living, the conferences that were arranged by the leader of the council last winter to bring together views from a range of stakeholders, including the voluntary sector in the city, about how we address this, and some of the work that we've got planned around better understanding the impact of these issues, for example, on people with learning disability in Portsmouth, and also some community participatory action research that we've got being undertaken in the city over the next few months, looking at particular communities. So those are just some of the kind of key things that we've summarised in the report, and there's some recommendations at the end on how we need to maintain the system-wide focus. Those recommendations have been to the Health Wellbeing Board, obviously coming here, and also very happy to present the report to Cabinet and full Council once we've developed the accessible version, so it's more user-friendly, if that's okay.
Thank you very much, Matt. Brian, any comments or questions?
No, not at this time, thank you.
Graham.
Yes, thank you, Matt. Excuse me, I did have a couple of questions. One sort of process question. I mean, are we going to produce a printed version that will be available, or is it all going to be online?
We weren't planning to print a version of it, but we can do if we think that there are people that would welcome that. It would be good to get a sense, if we can, of who that is, so we can keep costs as low as possible and just print those copies that we need. But I'm very happy to do that if it will be useful.
One of the reasons I ask is that sometimes I get copies of reports and things that I then give to the city archives, because if you've got a series of reports, and I know we do have historic annual reports for the health, how would they get a copy if they if they don't have a paper copy? I mean, obviously electronic copies are available, but where would they be accessed? I suppose that's what I'm just thinking about. Something maybe to ever think about when you're thinking about how to make sure the archive services get those. I want to ask a couple of questions about the contents of the report. Just to clarify, on page 36, large page 36, it talks about the two measures of poverty, relative low income, absolute low income. And then it talks about the fact that those two figures can come either with or without housing costs. Then goes on to talk about people in Portsmouth and families in either relative low income or absolute. So do we include housing costs, or do we not include housing costs in those figures? Because it says you can in the definitions above, but I don't know whether we do or don't in that.
I
Sort of, as I
will
read it, I thought, oh, I wonder. Anyway.
double check. We try to specify where we can whether they are included or not. There are some definitions that do include housing costs, or that split between with housing costs and without, and some that don't. So let me just double check. So this is which figure was it
It
specifically?
talks about,
Sorry.
it's on page 30, the large figure, page 36. It
Yeah.
talks about 1.21 children and young people living in relatively low-income families. Then it talks about, has the second highest proportion of children living in absolute low-income families. But I'm not clear, and I couldn't work out whether that includes housing costs or doesn't include housing costs.
I will.
There's some reference on the next page to an after-housing whole set of figures, so I just wondered if, sorry to be a bit nerdy, but
no, it's an important.
I just was curious as to, because obviously there is an impact if you include housing costs or don't include it. I think that will affect the figure, and it might also be interesting to look at what the impact is, either including or not including housing costs.
Yes.
But anyway, something maybe to think about before it's
So
fully
in
published.
that figure, equivalised income is income before housing costs, as is absolute low income. So yeah, they are both before housing costs.
Right. Okay.
Those ones.
It might be just worth having some sort of a note there just to make that clear, because I must admit I didn't pick that up when I read it. I couldn't see exactly that was it. But anyway, next question refers to one of the tables on large page 46. We did discuss this briefly in the pre-agenda meeting, and I think we talked about the impact of people's reaching key stage 2 at the top table was COVID impact. I think we thought was an impact there. Interestingly, the bottom table, which looks at the percentage of pupils achieving standard pass in English and maths, the figures obviously vary quite a bit, but I'm assuming the figures in sort of blocks that are in 2021 and 22 are based around teacher assessments. Is that the reason there, and that could be the reason they're slightly higher?
Yeah, absolutely. So we include those more for the relative position of Portsmouth compared to other areas. I think comparing year on year is as you say, for different reasons, either because of COVID impacts or because they're teacher assessed grades rather than exams. They do look very different both in Portsmouth and nationally as well.
But as you say, the thing to look at is the relative positions rather than the absolute figures.
Exactly,
so that's the key there. I just wanted to make sure I got that right. The other thing I wanted to ask about was on page 48, 49, where we talk about the levels of universal credit sanctions, and Portsmouth being significantly higher in attracting sanctions on claimants than other areas, including England. Do we think there's any inconsistency in the way, or differences in the way sanctions are being applied in Portsmouth compared to other places? Or are we getting any sort of anecdotal evidence from welfare organisations that Portsmouth is a particularly tough place, or are there other possible reasons why there could be such a high level of sanctions on claimants?
This has been discussed at the Tackling Poverty Steering Group, where we do have representatives from DWP and some of those welfare support organisations. I can't remember what the discussion focused on. We've got a meeting coming up at the end of November, so happy to take it back to them and ask to write to you with a proper response, if that's okay, Councillor Heaney.
Yeah, absolutely. That would be quite interesting. I'd quite interested like to know what their feelings are on that. I'm going to move on towards the end. Oops. And oops. Yeah, I mean, I suppose this is a point that I want to sort of leave for people to ponder on rather than anything else. I don't think I can get an answer here, but we talk in page 69, where it talks about member priorities, and it talks about the corporate plan approved by Cabinet, etc. And it says specifically, we help residents maximise their income, recognising the impact economic prosperity has on all aspects of people's lives, including health and well-being. We help people access grants and benefits, including council tax support and housing benefit, and household support grants for those in greatest need. And whilst that is true, the City Council still does require its poorest residents to pay 20% of their council tax. And I'm wondering if we may need to consider whether that is something that is helping people or hindering people's ability to deal with the cost of living crisis. I leave that there for people to ponder and consider, because I don't expect an answer today, but I think it's something that does need to maybe be considered. And I think that was it for me. The only thing I was going to suggest and really following on from what we discussed earlier, is I think this report has so much interesting information that if it is passed on to other elected members, I think they'd find it really worthwhile and useful. So if it does go to Cabinet and then to Council again, I think that would be very good. So thank you.
Thank you, Graham. Alan, did you want to make a comment at this point?
Well, thank you, Chair. You can't help but be very impressed by this report, both in terms of analysis and action, if I say so. I haven't a chance to look at it in detail, but just, if I may, one or two points. I think it's worth saying that, you know, in some cases, reading this, you might think Portsmouth is ridden with problems. Well, Portsmouth does have its problems. We all know that. You as local councillors know that. But I think the majority of people in this city, you know, they make the best of it. They struggle on. They work hard. They try and look after their families. And I think we're talking about a minority in many cases, in many of these issues. I may be wrong, but that's just a general point. Obviously, wearing my Pompey pensioner hat, looking at the information about older people, which is, I think, pretty well known, some of the inequalities, different parts of the city. Have I missed it, or is there something about helping people take up the benefits to which they're entitled? Because I know you in the City Council and Age Concern and even ourselves try quite hard to make sure people get pensioner credit, for example. There's quite a lot of data on that, isn't there? So that was one question. Should I finish and then? Yeah, okay. I mentioned this to my daughter who teaches in North End, and she asked me to point out that it's not just the results, the exam results that they take when they come into it's the progression within the school and for individuals, you know, and half of her class is on free school meals, she told me. But, you know, they do make progress, and both as on a school scale and also individuals. So she's proud of what she does in what used to be called, is it Bard Brunel? I don't know what it's called now. It's got a fancy new name, I think. But she wanted me to mention that. Just a couple of other points. I liked the section on what other places are doing. I like the sound of what Lewis are doing over in East Sussex, is it, or West Sussex? Very progressive little town, and their scheme to try and get older people involved and tell them what they can get seemed very appealing. I was going to ask about how you can get this to the public in large or organisations like ours, but I think Graham has already mentioned that. I'll just give you one experience. Every Saturday morning, I go down to Commercial Road. I used to go to Charlotte Street to do my shopping. Remember Charlotte Street? Some of you do. Well, there's only... I look around in Commercial Road and it's not a pretty sight, I'm afraid to say. There are vaping shops and vaping vans in double figures, and there's only one vegetable stall. So I just, Chair, as a little anecdote, you know, we've got our problems in Portsmouth, and I think vegetables are better than vaping. I believe that's the case. So I think the council's got a hell of a job on your hands, but very impressed by the report, and if there's anything we as Portsmouth pensioners can do to help, we'd be very glad to do so. Thank you, Chair.
Thank you, Alan. Matt.
Thank you. I'm sure if Helen was here, she would echo your point that vegetables are better than vaping. I'm confident in that one. In terms of your question around the benefits take-up, as Councillor Heaney said, it is flagged up in the report as a council, as a member priority, in terms of the corporate priorities, that is something we'll continue to do. And it is something that the Tackling Poverty Steering Group that leads on this agenda is very much focused on. So it's a key part of their work is how we ensure that people are accessing the support that is available to them, because we know that there is still a large proportion of support that goes unclaimed. So yeah, would definitely support that. In terms of the other things you talked about, I mean, as you say, there are a number of issues that will help to address these issues, through whether that's regeneration of the city or all the work that goes on in schools to support young people in their progression. We've taken the view that we'll keep the report it's quite deficit focused rather than asset focused. I think it is setting out the scale of the challenge without going into all of the things that are already happening to address that in terms of all the wider city plans. But there is, as you rightly say, an awful lot going on, but always more that we could do.
Thank you very much, Matt. Yeah, just some comments on this. I think the first thing to say is that unlike the previous reports, this was, as this is an annual report from the Director of Public Health, which is intended to be far and wide. So we'd already made the decision after the Health and Wellbeing Board, and I made that commitment to the Health and Wellbeing Board, that we'd bring it here to Cabinet and to full council as a full agenda item at full council as well, because it is, again, something that deserves to be seen far and wide. And actually, as we've been discussing now and previously, this is public health is something that permeates right across the council and in our community. I'd just like to point out again, as I did at Health Wellbeing Board, this is all based on our health wellbeing strategy, which is innovative and different from most other health wellbeing strategies, as we base our things on what is called the causes of the causes, and in this case that is poverty, this particular cause that we're concentrating on with this. And as Matt said, in its very nature it is deficit based, but that's because when we're looking at people's health and wellbeing, so much of it is impacted on their wealth. And indeed, if you're in poverty, then your outcomes are so much worse than if you're not in poverty. And as Alan said, for many years, and actually I was talking to Councillor Leah Madden today about this, and he said that a lot of these issues that we are tackling now, we were tackling, yourself and him, Alan, were tackling back in the 90s and even into the 80s as well. So it's been a long process, but I think hauling around the way we think about these things as a lot more holistic, rather than being this sits here and that sits there, I think is very much a case of why the Director of Public Health made this as the priority this year. I was just going to say about school progression, something that Alan picked up on. When I was a school governor in Milton Park, that was just when that came in terms of inspection, in terms of progression, rather than the straight results. So that is something that obviously we're well aware of, and it's also always worth pointing out our Portsmouth paradox, as it's called, which is our schools have increasingly good inspection results, but our results in the city are still well below average, which is one of the things of, you've got a good school, but our results aren't what maybe they would be expected to be. But one of the things, as Alan has quite rightly said, if you take into account where a lot of our children are coming from, our results are better than the raw figures suggest. Just as some DWP experience, having been an employee of that august organisation up to 9 years ago, I would probably think the answer, Matt, is that that there has been a certain push within the DWP locally, looking at the difference between here and Southampton. All it takes, to be honest, is a manager or two who really puts an onus on the staff to do things in one job centre or in one and then another one, there's not so much of an onus. So I think it's probably as simple as that. It certainly was in my experience that one of the great things about the DWP is it might be a national organisation, but they keep making priorities on a very, very local basis, which might be fly in the face of each other in very close proximity. just about that thing as it was picked out as being as a cabinet priority, obviously about making sure that people can claim the right benefits. That is obviously the Attacking Poverty Steering Group, and I'd like to thank Mark Sage and his new team, as he has, but also the steering group that he leads on that and has been doing for many years. That really has embedded that right across not just statutory sector, but also the voluntary community and social enterprise sector as well. And really that steering group does give that opportunity really to bring everyone together so that they're recognising what that is. I was thinking about the report being printed off. I think certainly I'm sure we could get a couple of reports for archiving, etc., printed off in full. But I was thinking, Matt, perhaps when we produce the summary for Cabinet and full Council, that having the summary report, having quite a few copies of the summary report, which would obviously keep the cost down anyway because they'll be much shorter, but that might be really helpful for people to have, and that might be, especially thinking, Alan, for people like Pompey pensioners, having something that's paper-based might be quite helpful and as a jumping off point, and then if they wanted to have something more, the full report, then that could be requested at the time. And then just my final thing, and it's I was saying to Alan again earlier, one of the things that we do here by, as I said, having a different kind of report, a different kind of strategy, is that we've also presented this across the integrated care system in Hampshire and Isle of Wight. And I went to the first assembly in summer last year that we did, where we had presentations from each of the directors of public health, and they did all based on their health and wellbeing strategies. Our health and wellbeing strategy was radically different from the others, and what was almost universally liked about that, and it will have an impact on the other places' health and wellbeing strategies in the future, was the fact of the causes of the causes. Because what people from all these different organisations could see is about how things to do with public health really do feed into every part of the statutory and non-statutory sector, and indeed private sector. Let's never forget the private sector, because for us locally, for example, they have a huge impact on things like social care, and also other organisations that keep things going. So thank you everyone for your comments, and just
Could I speak, Matt, please?
Yeah, absolutely, Brian. And then just on that on that last bit for the point from Graham, I think the bit about the council tax, and I thank you for that. I think I was around, I think, when that decision was taken to reintroduce that for the poorest, but I think it's one of those ones whereby the council finances were such that we would, I think, love to be able to not have people pay it, but I think we're in a position where we have no choice, and that is a vagary of central government ongoing cuts which go back so long, and that it is obviously in the base. But I would agree, Graham, I think that it would be good if we had a commitment from central government which would give us the funding to be able to actually enable the very poorest people in society to not have to pay pretty much any tax at all, other than things like VAT, which is obviously a consumption tax. So, but I think it's always well worth pointing out about where councils have had to go, and we know obviously it's not just our council, it's many councils around the country, and of course lots of other councils are going to have to make some even more unpalatable decisions about what people are going to be paying tax-wise locally, and in their exemptions will have to get less and less, who are in much worse financial shape than this authority. Brian, I'll just come to you now.
First of all, I apologise. I thought you was ending there and going on to the next one, so I apologise for interrupting.
Oh, so you're on to the next one you were wanting to...
No, I don't want the next one. I want this one.
Okay, yeah, go on.
Those of you who know me, and obviously know my councillor's son, George, will know that we sit here and I want to say things at council meetings, etc. And I'm told, no, Dad, no, Dad, no, Dad, don't say that, don't say that. You asked me if I had any questions, and I said no, not at this moment of time, because I don't know whether I should say what I'm going to say. But to hell with it, I'll say it. Who decides on the poverty levels? Who checks on the poverty levels? Who believes the poverty level figures? I was doing surgeries in the Methodist Church Hall in Portsgrove, my surgeries every week, and it was the same day as Food Bank. And we had this lady who used to come in it wasn't every week, but anyway, she used to come in all the time. And she was very demanding of what she got, etc., etc. And outside, her husband was sat in a 4x4 petrol guzzler, diesel guzzler. She kicked off once there about what she got, and she was very angry, i.e. that's why I recognised her, and the face was there forever. About 3 weeks later, I'm in Tesco's on Southampton Road, and I'm going to get take a electrical item I bought back because it wasn't working properly. So I was at customer services, and I see her there with her 2 kiddies. Whether it's only 2 kiddies or not, I don't know. But I see her there, and she bought 40 silk cut and a fistful, and I mean a fistful, of scratch cards. Now that woman is probably poverty. That woman is probably down, getting every benefit going, etc., etc. They got a 4x4, right? And they're moaning about how much food they get. It's something which annoys me, but I don't know how you control it, and I don't know where you get your figures from, because obviously I presume the government gives figures that A, B, and C must have so much per week, etc., etc., etc. These are having plenty, because if you can afford to buy a fistful of scratch cards, which I can't do, and that's presumably every week, lottery tickets or whatever, but it's scratch cards she had in her hand. And how do you control that? Can you control that? Or is there people who check up on that? I don't know, because a lot of these who are on poverty here are probably not on poverty at all. We all know the system. But is there anything can be done about that? I'm not against any person who genuinely needs it. I've supported charities through my business and that all my life and personally. So I'm not on about giving to the people who need it. I used to support the deaf, and I used to support children with leukemia, etc., etc. So I'm not on against people who need it getting it. What I'm on about is people who don't need it getting it. Is there anything we can do? And the poverty figures are probably not right. They might claim it, and they might come under whatever it is, but it's not what they're getting and what they need or what they deserve. Is there anything that's, I don't know, can be done or can be checked on, or do people check on these people? Because I hate to see poverty figures rising when I don't believe they are. Because if you can afford a handful of scratch cards, you're not in poverty. And you're getting food from the food bank when you could spend that money on your scratch cards on food for the children. So it's just something that does me head in. Thank you, Chair. So,
I mean, there's quite a lot in there, and I think some of it I can probably respond to better than other bits. The numbers, I mean, the definitions of poverty are set by the government, and they're based on a percentage of, so relative poverty is based on having 60%, less than 60% of the median income in the country at the time. Absolute poverty is based on a kind of defined level of 2010 levels, so it's less than 60% of that, so it's then adjusted for inflation. So there are national definitions in terms of the poverty. There are then a number of other things within that in terms of benefits levels, which I think a lot of what you were talking about, where again there are set criteria that absolutely are monitored and checked on, but clearly there will be I would suggest probably small numbers, but some individuals that have other sources of income and are claiming. But there is national data from DWP on levels of benefit fraud, for example, which it's a very small percentage of the total amount. And I think the government do try very hard to ensure that people aren't claiming benefits that they're not entitled to. The overall level of benefits themselves are measurably lower than they were at any point over the last 30 years. So there are ways of comparing it, but it's difficult in terms of individual cases because, clearly there's a lot of variation in individual circumstances, and the decisions that people make on how they manage the money that they do have coming in. Okay, did you want to say anything else on that?
Put it off. Sorry. Only just one point to add to Matt's point, if indeed it's helpful, and absolutely recognise, what you're saying. I think Matt's definitions there around the data are really helpful, and also recognition of how the system works together in terms of supporting people. But I also just think it's important to recognise or further highlight what Matt has said there around recognising the complexity of people's lives in terms of, that even if people are, absolutely struggling in terms of cost of living and in terms of how that plays out in terms of that complex factors that people might be experiencing, whether that's addiction or substance misuse or domestic abuse or whatever it is, and therefore it's very difficult, I think, to really, understand people's individual circumstances and their stories in their lives, and therefore, that the role of us as a system to absolutely apply, the right systems, the right processes, but also, I think, take a mental healthily informed and trauma-informed approach to how we deliver and care as a city, I think, is really important.
Thank you very much. Thank you, Chair.
Thank you. And just as just on the food bank issue, so I think I'm right in saying now that all food banks in the city, you have to have a referral form to access, and so obviously the people who are doing those referral forms will be going on trust with the people who are saying that they're in need of that, and in the end they're not there to scrutinise their bank accounts. So in the end, that those people and having worked in an advisory role at a food bank in the past, I would say the amount of people who abuse it are very small, and therefore some of them who are going to take the mick, so to speak, are a very small proportion, but obviously the vast majority of people are really in dire need of the food. So I think unfortunately some people lie, and that's the reality of it, and the people who are giving them the vouchers on trust are having that trust abused, but there's not really very much you can do about it. And as you say, you've already given out the food, and you've already and then they go off and they do something else with money, then I mean, the food's already been given, and that's it. At the same time, when people are abusive, or if they're getting things and they're unpleasant about it, they have been barred from food banks. So if and I have seen that happen. I've seen someone who's complained about what they've got quite unpleasantly, and they've said, "Well, please leave." If you're in need, you do take what you're given, very much so. But unfortunately, the fact that food banks exist at all it continues to be a great shame, really, for the country, and obviously things like pantries, etc., as well, which they've also moved to as well. But yeah, unfortunately, you always get a few people who are playing the system, but the vast majority of people are absolutely in need. Okay, so happy to note that report. Thank you everyone for all your contributions on that. That's been really, really good. So, on to item 5, liberty, protection safeguards and deprivation of liberty safeguards. Andy.
Thank you, Chair. So the report is to set out the implications for deprivation of liberty safeguards service now that there is no clear pathway for the introduction of the liberty protection safeguards. I'll just pick out some highlights as you've got the report before you. So we have 2 recommendations around correspondence to the Secretary of State and correspondence with local members of Parliament. Under the background, under section 3, there's some, I suppose you call it technical information about what liberty protection safeguards is and how it relates to deprivation of liberty safeguards, and the timeline that was in place for LPS, liberty protection safeguards, to be introduced, which has now become extinct. In effect, the government have formally announced that LPS will not be introduced in this Parliament, so we have no guarantee as to when that will happen. We've then included some information about the social care sector expressing concerns about this delay, and then some historical information in the rest of section 3 about how Dole's deprivation of liberty safeguards was introduced, what it means, essentially ensuring that anyone who is deprived of their liberty goes through a legal process for that to happen. Under section 3 on the next page, there's more information about why there was a need for a change to the Dole's process, and we then move into some of the statistics around Dole's applications and backlogs for assessments. Moving on to the next page. What we note from both of the tables contained on the subsequent 2 pages is that Portsmouth is in a relatively fortunate position that we don't run a significant pending list for those people waiting an authorisation for deprivation of liberty. When you compare us to those family comparators in that second table there. It's in the main because we have a dedicated team that works both with deprivation of liberty and with our Mental Health Act assessments, and we've always been fortunate in that respect. So that's how we manage that number down and try not to keep people waiting. So under section 4 and going through into 4.1, the main concern for us in Portsmouth around not having the liberty protection safeguards in place it relates to those people that live in a community setting to whom Dole's does not apply. So those folk, in very broad terms, have to be individually identified, and we then have to apply to the Court of Protection to gain a legal mechanism to deprive them of their liberty. Through the rest of section 4 is some information about some of the numbers that we do know around those folk within our community to whom that would apply. And some of the work we're doing to identify the maximum number of people to whom we think that could apply. Under section 4.2, then talk about how that applies to people who are 16 and 17 years old and may be unable to make decisions for themselves. And we need to, as it says in the last paragraph under 4.2, we need to understand the numbers there. So we're following an appropriate legal process and applying to the court. It may not be the Court of Protection for the people of that age group. It may be the High Court, something called inherent jurisdiction. But in either circumstance, an application is needed. We haven't completed an integrated impact assessment because there's been no change in the legislation or the process around this. And there aren't any current legal or financial implications except those that arise from making application to the court. There is an individual cost in the nature of about £300 for each application, and there is, of course, the time of the individual practitioner for making those referrals. So that's the report as it's before you, but of course happy to take any questions, queries or comments. Thank you.
Thanks, Andy. Graham, any comments or questions?
Excuse me, we did discuss this at the briefing meeting, and I think the puzzle here is why the government isn't getting on with the issue of dealing with this, because I mean it does in fact impact on people and people who are vulnerable, and the sooner we can get this resolved the better, which is why I think the recommendations were put forward as a way of trying to give it a bit of a push. How successful that will be, obviously, we'll have to wait and see, but hopefully it might indicate that there is raised concern about this, and I mean, I think the report's fairly self-explanatory. But yeah, we do need this to be moved forward in some way.
Thanks, Graham. Brian, any comments, questions?
Yes, Andy, this 4.2 obviously means quite a bit to me in my other role as scrutiny of the young children, etc. So I will study this a bit more and probably bring it up in scrutiny on Thursday. But it's useful information for me. Thank you very much.
Thanks, Brian. This has been rumbling on for a long time, as the report sets out. It was originally going to come in October 2020. Obviously, the pandemic, we could accept and understand that the pandemic got in the way of implementation at that time. But it was the real hammer blow in April when all councils have been working on this for 3 years and then suddenly told it will not be in this Parliament, however much longer this Parliament goes on, which was an absolute kick in the teeth, bearing in mind the work that had gone on within councils, and obviously in our council in particular, preparing for this, and having the and having all the prep, including having staff that we'd employed specifically to do this work. So I'd like to particularly thank Jackie Bickers, who has prepared this report for us, who's been working on this for a long time. And indeed, we want to keep these people. So indeed, there's been some work we've been doing to make sure we can have work within the council in similar things, because otherwise you have to recruit all over again whenever this does happen, because we know it will happen. And so we're in a fortunate position whereby we have managed to retain that staffing, with other project work that we've got in the interim that also needs doing, that we've then got them on hand then to go back to this whenever hopefully the next government gets through this and implements this as soon as possible. I was talking to my former colleague when I worked for Solent Mines, who is the manager of the advocacy service, and that's just a reminder that this just hasn't just impacted on people who are subject to these proceedings, but also and not just on the professionals within the statutory sector, but also in that wider sector, especially the statutory advocacy service, which are almost entirely around the country run by the voluntary community and social enterprise sector. And again, they have had to go through specific training for this. That has been to cost of charities to get this training done, and yet these still have not come in. And it is, and as Andy mentioned about the court of protection, where they do not come under DOLS, the deprivation of liberty safeguards, but would have come under the liberty protection safeguards, that causes huge amounts of problems within the court service. So as Graham, I completely agree with Graham on this. Why has this not been implemented? I have no idea. Thus the recommendations are that I write both to the Secretary of State raising concerns about why this has not happened and why there is no timetable. I would hope, even if it's not going until after the next general election, that they might have an idea on what this government's timetable might be post-general election. But also for both of our Portsmouth Parliament members who may not have be cited of this as one of their priorities, but I think it would be really helpful if they are made aware of this, and then they could also push up both in their own parties and to the government itself to say what's going on and can this be made a priority, because whoever is in government after the next general election is going to have to deal with this, and it needs to be dealing with it as soon as they possibly can, because this cannot be left just to go on for longer. As Andy said, we are in a good situation here, relatively speaking, when we're looking at places like Kent with over 1,000 people who are waiting for a decision under DOLS. That's just completely unacceptable, and the amount of risk there is outrageous. So this really just needs to be done as quickly as possible. So I'm very happy to accept those recommendations, which is the Cabinet Member writes to the Secretary of State raising concerns the LPS have not been implemented and there is no timetable to do so, and that's the Cabinet Member to write to the Members of Parliament for Portsmouth and invite them to contact the Secretary of State and express their concerns as well. So thank you very much for that. And finally, item number 6, adult social care complaints, annual reports. Back to you, Andy.
Thank you, Chair. So the report in front of you, we bring this report every year to this particular forum to update Cabinet Member and spokespeople on the complaints we receive in adult social care. You'll see under the information requested, it's an analysis of the complaints and other contacts, and then comparisons against the previous 12 months. So I'll just pick out some of the main points from the report as you've got it in front of you. So we've got 74 statutory complaints compared to 51 the previous year. and included within the 22-23 rating following an independent provider compared to 3 in the previous financial year. We've had customer contacts, 13 potential complaints and 6 contacts that were responded to under other procedures. So whilst we provide a service, a funded service to around about 2,000, 2,300 people on an annual basis, we have contact with far more people in the city. So in that third paragraph under section 4, the 74 complaints received represent less than 1% of the people who receive some kind of service from adult social care, be that information, advice, maybe rather than funded services. Moving into the next page, we've got a couple of tables showing, broadly speaking, where the complaints landed, the area of adult social care that those complaints landed in, and then the following table, the reason for complaints. And the most prevalent reasons were service, inadequate service, communication and staff behaviour, things we saw this year. The adult social care complaints process, unlike other in the public sector, doesn't have any laid down specific time frame. So we've laid out the time frame that we aim to respond to in section 5. And then we've put a table under section 5 of how we've met. We've seen a slight decrease in the last year of those responded to within 10 working days and those that took 20 plus more days to respond to. Under section 6, we've outlined the complaints that proceeded to the social care ombudsman. That's the minority of complaints. We do try and resolve complaints locally through our established procedure so that we hope that the majority don't go to the social care ombudsman. When they do go to the ombudsman looks at all the evidence that they've requested us to send. They listen to what the person complaining has said, and then they come up with a judgment. They either find the council at fault or not at fault, and then sometimes recommend compensation or other forms of redress. And so the narrative under section 6 talks to those complaints that we've received, that the ombudsman, has received, and the redress that they have recommended, and we've complied with that redress as requested by the ombudsman. We've mentioned advocacy already in another context in this meeting, so we do, if people request an advocate to help them make a complaint, that's provided. And then we've also, under section 8, talked about the complaints that we've received that haven't gone to the ombudsman that we've either upheld or partially upheld. It's a slight decrease, about 10% decrease, a little more than slight, on those that were justified in some way last year. We've set out there that we see some of our complaints dealt with in other arenas because some of our services are provided through integrated services through our NHS colleagues. And this year it's been, we've also touched under section 10 on compliments. And this year under section 11, we would see it as a positive that we haven't designated anyone a persistent complainant. Always trying to work to get behind the reason to the complaint and to resolve the complaint rather than necessarily designate someone as a consistent complainant. So that's a positive for us. We've also then touched on under section 12 the number of councillor and MP inquiries that we receive. There is a significant increase compared to last year. My personal view is that's an accuracy of recording issue, so I think we're getting better at recording and formally noting councillor and MP contacts. So that's probably the reason for that large jump I would surmise in this year. And then under section 13, we've given just a couple of examples of how we try to learn from complaints. So there is a loop between the complaint made and how the service then functions. And then finally, we touch on the training available and support to staff from the complaints managers. I hope that's helpful to you, but of course, happy to take any questions or queries. Thank you.
Thanks, Andy. Brian, any comments or questions?
Fine with that. Perfect. Thank you.
Thanks, Brian. Graham?
No, I'm very happy with the report. The fact that 69 of the 74 complaints were resolved internally, I mean, obviously is good, and there don't seem to be any outstanding issues that strike us as problematic. I think that given the numbers involved, it's we've got acceptable explanations as to what's going on, so I'm happy with that report.
Thank you very much. Yeah, just a couple of comments from me. I think I always like to see that we also include in this report about compliments. It's one of the things I know in the public sector, they always have problems asking for compliments, and therefore only having 16, it's good that they've had 16, but that was a decrease of 19 from last year, and I do know that recording, and I know myself and Andy have discussed this over the course of this year, is trying to encourage the teams to be better at actually accepting compliments when they're given, because obviously often they get them where they think, oh, I should be, well, it's just someone saying thank you to me, so that is a compliment. So it's about making sure that's recorded, but also at the same time is actually soliciting it, because if someone is really grateful for the service they've had, say, well, would you mind put that in writing? And the vast majority of people will do that if they do it. And I know it's something that when you're in any kind of sector where you're doing the service for doing the service, you don't think of doing that, but actually we do know how many people are so grateful for the services that are done. But seeking compliments are good, and doing that. As for the complaints, and again, I've worked my last job. Half my last job in the DWP was doing complaints, and so having so few going to the Ombudsman really does show that they're being done properly and handled properly. But also the learning is really important, and I'm really pleased that we do take that from that. And also our numbers within 20 days and 20 plus days are very similar to last year, which I think is nearly 80% within 20 days is very, very professional and very good. And I think that actually the numbers as a whole, less than 1% of our total is very positive. So always things to learn and things we can do better. But I'd like to thank Andy for the report, and Natalie Beckett and John Thomas, who are the two complaint managers for adult social care. Happy to know that report, and that concludes the meeting, ladies and gentlemen. Thank you very much.